Okay, so now we are done with the protozoans. Okay, so this is done. Now let's start with the helminths. Okay, so helminths include nematyhelminths and the platyhelminths. Literal meaning, nematyhelminths are roundworms, platyhelminths are flatworms. Okay, they are flatworms. Now, based on whether the platyhelminths are segmented or not segmented, they are classified into trematodes or flukes, which are unsegmented, and cestodes, which are segmented, which are called tapeworms. You can remember it like cello tape. Okay, so cestode for tapeworms. Now, also you remember that trematodes are leaf-like in shape. I'll show you an example. So trematodes are leaf-like in shape. Okay. So this is how a trematode looks like. Okay, this is how a trematode looks like. It is leaf-like in shape. Okay, so you can remember the tree has leaves. Okay, so trematode leaf-like in shape. Okay, trematode is leaf-like in shape. And cestodes are tapeworms, right? They are segmented tapeworms. Okay, they look like this. Now out of cestodes, trematodes, nematodes, the most developed is the nematode. Okay, now this nematode will have everything. It will have a body cavity, it will have a well developed gut, it will have buccal capsule, and it is dioecious. What is dioecious? It has separate males and females, just like humans. Okay, the males and females are different. Now cestode is the least developed. So here it is monoecious. That means male and female organs are present in the same organism. It has suckers with hooks. There is no alimentary canal. There is no body cavity. Trematodes are in the middle. They don't have a body cavity, but they have a poorly developed gut. Cestodes don't have gut. Okay, trematodes have a poorly developed gut. They are also monoecious except for one organism, which is cystosoma. Okay, cystosoma is dioecious. Now let us start with trematodes. What are the examples of trematodes? Examples of trematodes include cystosoma, Clonorchis senescens, Fasciola hepatica, Paragonimus westermani. Now take some time and learn this. Okay, what are the examples of trematodes? Cystosoma, 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 okay, cystosoma, which is blood fluke, Clonorchis senescens, Chinese liver fluke, Fasciola hepatica liver fluke, Paragonimus westermani lung fluke. Okay, again, cystosoma, Clonorchis senescens, Fasciola hepatica, Paragonimus westermani, all of them are trematodes. Okay, all of them are trematodes. Again, cystosoma is blood fluke, Clonorchis senescens is Chinese liver fluke, Fasciola hepatica is liver fluke, Paragonimus westermani is lung fluke. Now, based on the name itself, you'll know where it causes the problem. Okay, so where is cystosoma present? It is present in the blood, right? So it will be present in the venous plexuses. Okay, venous plexus. Now it depends on which cystosoma. Okay, liver fluke will be in the liver. Fasciola hepatica again liver. Paragonimus westermani will cause lung related problems. Okay, so now let us study in detail what does it cause. So about trematodes, I told you trematodes. Okay, one thing before we start, I'll just tell you that in trematodes, every time the exception is cystosoma. Example, all are monoecious except cystosoma. All have operculated eggs. What's an operculated egg? It is an egg which will have a lid-like structure. Okay, that lid-like structure is called operculum. I'll show you here. So look at this egg here. So you can see this lid-like structure. That is the operculum. Here you can see this lid-like structure. That is the operculum. Okay. So all the eggs of the trematodes are operculated except cystosoma. All of them have two intermediate hosts. Okay, all trematodes have two intermediate hosts. Example, the first intermediate host is always snail. Okay. For Fasciola hepatica, second intermediate host is aquatic plants. For Clonorchis, second intermediate host is fish. For Paragonimus, second intermediate host is crab. Okay, but again, except cystosoma, cystosoma has only one intermediate host, which is snail. Cystosoma has only one intermediate host, that is snail. And in all of them, the infective stage is metacercaria, except cystosoma, in which it is cercaria. Okay. So now let us look at the cystosoma. Now there are three types: cystosoma hematobium, Manzoni, japonicum. Japonicum is present in the superior mesenteric plexus, Manzoni in the inferior mesenteric plexus. Hematobium is the most important, present in the vesical plexus, that means in the bladder plexus, right? So this hematobium causes squamous cell cancer of the urinary bladder. Okay, what is the most common cancer of the urinary bladder? It is transitional cell cancer, but squamous cell cancer is caused by cystosoma. It has been asked. Now how do you differentiate the eggs? Very important. Japonicum has a rounded egg with a knob. Hematobium has a terminal spine. Manzoni has a lateral spine. Okay, very important. Now this is how I told you cystosoma is dioecious, right? So this is the female worm, and the inside you have this male worm. Okay, this is how cystosoma looks like. Now this egg, you see, this has a lateral spine, so this is Manzoni. Terminal spine hematobium. Rounded egg with a knob, that is japonicum. Okay, next what is left? We have fasciola hepatica. Na? Fasciola hepatica is sheep liver fluke. So obviously in this image, look at this, you can see the liver is infected by these leaf-like worms, which are cystosoma, which are fasciola hepatica. So the first intermediate host always is snail. Second intermediate host for fasciola is aquatic vegetation. Clonorchis senescens, first intermediate host always you have snail. Second intermediate host, what is it? For fish, right? For Clonorchis senescens. And specific thing about Clonorchis, remember C for cholangiocarcinoma. So it infects the liver, right? Near the liver, what do you have? You have the gallbladder. So the gallbladder cancer is caused by Clonorchis senescens. It's very important, okay? Clonorchis senescens, cholangiocarcinoma. Next you have Paragonimus westermanni, which was the lung fluke, right? So the lung fluke, what will it cause? It will cause lung related symptoms, cough, sputum, okay? A reddish brown sputum. First intermediate host is always snail. Second one is the crab or crayfish. Okay. Now the eggs of trematodes are not really asked that much, except for cystosoma is asked a lot of times. Okay, but still, if in case they ask you Clonorchis and Paragonimus, both will be operculated. Okay. If you see a thickened posterior end, okay, thickened posterior end, that is for Paragonimus westermanni. Okay. And if it looks like a kettle, okay, that is the appearance of Clonorchis senescens. Operculated, but posterior end doesn't have a thickened end. Okay, so that's about the trematodes. Then we have the cestodes, right? So let us go to the table. So in cestodes, let's first learn the examples. The examples of cestodes are Taenia solium, Taenia saginata, Diphyllobothrium latum, Echinococcus granulosus, and Hymenolithus mustata. Again, Taenia solium, Taenia saginata, Diphyllobothrium latum, Echinococcus granulosus, H. nana. Again, Taenia solium, Taenia saginata, Diphyllobothrium latum, and Echinococcus granulosus, and H. nana. Okay. Now let us study in detail about them. So cestodes में first cestode is first you should learn the definitive host and intermediate host of all these cestodes. The definitive host is always man except for Echinococcus, in which it is dog. Okay. Definitive host for the cestodes is always man except for Echinococcus, in which it is dog. Okay. Now intermediate host changes. For Taenia solium, it is pig. Okay, so if you eat pork, contaminated pork, you can get Taenia solium infection. Okay. Taenia saginata is cow or cattle. Okay, the intermediate host is cow or cattle. Diphyllobothrium, it has di in its name, so it has two intermediate hosts. Okay, just like trematodes, right? Trematodes also have two intermediate hosts. Diphyllobothrium latum also has two intermediate hosts. First intermediate host is cyclops. Second intermediate host is fish. For Echinococcus granulosus, the intermediate host is man or sheep. Okay. For Hymenolithus nana, both are man. Okay. So nana मतलब nana man ही होगा ना, तो man and man. Okay. So Hymenolithus nana, the intermediate host and the definitive host both are man. Okay. Try to learn this. Take some time and learn it. Okay. Now let us first start with Diphyllobothrium latum. The intermediate host is fish, right? So it is also called fish tapeworm. Diphyllobothrium latum is also called fish tapeworm. Okay. Now this is a very long tapeworm. Okay, it's a very long tapeworm. Diphyllobothrium latum is a very long tapeworm. Look at the size. Okay. Now, specific thing about Diphyllobothrium latum is it causes megaloblastic anemia, which is very important. When you talk about hookworms, okay, hookworms cause iron deficiency anemia, okay, but the Diphyllobothrium latum, repeated question, it causes megaloblastic anemia because it interferes with the B12 absorption, okay. Now, how do you identify the egg? Again, this egg is not so important, but this will also have an operculum. It will have a lid with a posterior knob. You can see the structure. This is a posterior knob. Okay, I told you thickened posterior end, that was different. Okay, thickened posterior end is different. If you have an operculated egg with a posterior knob, that is most likely the egg of Diphyllobothrium latum. Not so important. Next you go to Hymenolapis nana, very important egg. Okay, so how do you identify this? Is also called dwarf tapeworm. The egg has polar filaments with central hooks. Okay, so you have the polar filaments and you have the central hooks. Okay, so this is a very important egg. You should know how to identify the egg of Hymenolapis nana. Echinococcus granulosus, dog tapeworm. A definitive host is dog, right? It causes hydatid cysts. These are the hydatid cysts. Okay, this is a very small tapeworm. Okay, very short, very small tapeworm. What is the treatment of hydatid cyst? You use a therapy called PAIR, right? Cestodes may. So there are just then you have Taenia solium versus saginata. So first let us revise this. Cestodes, Diphyllobothrium latum is called fish tapeworm. Okay, because the second intermediate host is fish. Diphyllobothrium latum, important to remember. Remember the 2 for di and remember B12. Okay, so that also has a 2. So B12 absorption ke liye Diphyllobothrium latum. Hymenolapis nana, the egg. Learn to identify the egg. Echinococcus granulosus, you know it causes hydatid cyst. In hydatid cyst, you have the water lily sign. The treatment is PAIR, right? It is a very short tapeworm. Okay. Now Taenia solium versus saginata. How to identify? If you see the hook, this is the scolex. Okay, the head is called the scolex. If the scolex has hooklets, without hooklets, that is saginata, but if it has hooklets, that's solium. Okay, how do I remember? So that's why this solium is called armed tapeworm. Armed tapeworm. Why is it called armed? Because it has hooklets. Okay, so you can remember that soldiers, solium for soldiers. Okay, so soldiers have armor, right? So if you see this hooklets here, it looks like armor, so it is most likely solium. Okay, now solium is shorter. Look at the name of solium, it is shorter, right? And the name of saginata, it is a longer tapeworm. Okay, solium is, so see, now tapeworms, you know, they are segmented, right? They are segmented. Now this each segment is called a proglottid. Okay, so Taenia solium is shorter, so it has less proglottids. Okay, and Taenia saginata is longer, it has more proglottids. Another difference you can find out is by looking at the uterus. Okay, this is the uterus of the solium and saginata. If you see less branch, see, you can see less branches here, and here you can see multiple branches, right? So if you have many branches, that is most likely saginata. Okay, how does it get transmitted? What is the intermediate host of solium? It is pig, right? So the uncooked pork will contain larva, which is called Cysticercus cellulose. Remember the name of the larva. The larva is called Cysticercus cellulose for what? For solium. And the larva is called Cysticercus bovis for saginata. Okay, so by uncooked beef you can get saginata. For by uncooked pork you can get solium. Okay, Cysticercus cellulose is for solium, Cysticercus bovis is for saginata. So whenever you eat the whenever you ingest the larva, both of them have the presentation of diarrhea. Okay, when you ingest the eggs of solium, that time you get neurocysticercosis. Okay, which which will have the starry sky appearance, right? So neurocysticercosis is by ingestion of the eggs of solium. Most common site of neurocysticercosis is the subarachnoid. If you ingest the eggs of saginata, nothing will happen, okay? If you ingest the eggs of saginata, nothing happens, okay? So that is about the cestodes. Next, what we have left is the nematodes, okay? Before that, let us go to the table and revise the cestodes. Okay, so in the cestodes, cestodes are also called tapeworms, right? Cellotape. So Taenia solium versus saginata. Saginata is longer, solium is shorter. Solium has hooklets, okay? So solium is armed tapeworm is solium, okay? Saginata will have more uterine branches, okay? Uterine branches will also be more. Now, which is transmitted by the pork, that is solium, by beef, that is saginata, okay? Now, Cysticercus bovis is for saginata, okay? Cysticercus cellulosae is for solium, okay? So those are the main differences. Neurocysticercosis is caused by solium. Diphyllobothrium latum, important thing, it's called fish tapeworm and it interferes with B12 absorption, causes megaloblastic anemia. Echinococcus granulosus causes hydatid cysts, okay? Short tapeworm. Diphyllobothrium latum is a very long tapeworm. Hymenolapis nana, you should remember the egg with the polar filaments and the central hooks, okay? So that is about the cestodes. Now let's go to the nematodes, okay? Now nematodes, as you see here, they are classified into small intestinal nematodes, large intestinal nematodes and tissue nematodes, okay? Let us start with the small intestinal nematodes. Okay, before starting, we'll learn some mnemonics here. What are the organisms transmitted by eating eggs? Okay, so the mnemonic is eat, Enterobius, Ascaris, Trichuris, Trichura. Okay, you will get familiarized with the names when we start studying. Enterobius vermicularis, Ascaris, Trichuris, Trichura. Okay, for eat, transmitted by eating the eggs. Transmission by penetration of the sole of the foot. Okay, so when the worms penetrate the sole of the foot, that time the infection starts. That is for ANS. Okay, Ancylostoma duodenale, Necator americanus, and both of these are what? Both of these are, what are they? They are hookworms, okay? They are hookworms. And then Strongyloides turcularis. Requires lung for maturation. So again ANS, but add Ascaris also, okay? So this is some important mnemonics. If you learn this, it's very easy. Let us start with the large intestinal nematodes, okay? 2. Very important, okay? 2 important. These both are very, very, very important. So Trichuris trichura versus Enterobius vermicularis. Trichuris trichura is also called what? Whipworm. Okay, it's called whipworm. The egg is very important. So how does the egg look? The egg is barrel shaped and it has mucus plugs on both ends, okay? Mucus plugs on both ends, okay? Barrel shaped egg with mucus plugs on both ends, that is for Trichuris trichura. Now Trichuris trichura is a part of eat, right? Eat. So it is transmitted by eating the eggs. This is how the worm looks like. It looks like a whip, okay? That's why it's called whipworm. What does it cause? Very, very important. It causes rectal prolapse or coconut cake like rectum. Both of them are caused by Trichuris trichura, okay? Learn this. Trichuris trichura is very important. Next you go to Enterobius vermicularis, okay? Enterobius vermicularis, also called pinworm or seatworm, and it causes oxyuriasis, okay? Infection by Enterobius is called oxyuriasis. How does it present? It will present with perianal pruritus, okay? Perianal pruritus. The egg is very important again. It's a D-shaped egg. One side will be flattened, another side will be convex, okay? So a D-shaped egg is for Enterobius, okay? Remember, after D you have E, okay? So D-shaped egg is for Enterobius. How do you test for Enterobius? Basically, you can do the Scotch tape test, okay? So what do you do here? You take a Scotch tape, okay? You take a Scotch tape and then you apply it at the perianal area, and then you will place it on a glass slide, and then you can look at the worms. Okay, so again, Trichuris trichura causes rectal prolapse, coconut cake like rectum. Enterobius causes perianal itching. Very, very, very important. Okay, very important. This, I'm telling you, large intestinal nematodes are very important. They have been asked multiple times. Even the presentation and the egg, both are important. And what are they called? Okay, pinworm, seatworm is for enterobius. Whipworm is for Trichuris trichura. Next we have the small intestinal nematodes. Okay, three of them: Ascaris, hookworms, and Strongyloides. Now Ascaris, look at the eggs. Okay, it can be asked. Now Ascaris eggs can either be corticated, decorticated. Okay, now this thing you see on the end, these are the cortications. Okay, now this is a corticated unfertilized egg, this is a corticated fertilized egg. Okay, and this is a decorticated but fertilized egg. Okay, so this is how the eggs of Ascaris look like. Now what can Ascaris cause? Look here, these are roundworms, right? Nematodes are roundworms. So these roundworms can cause complete intestinal obstruction. They can also cause intussusception. Okay, remember intussusception has current jelly stools. Ascaris can also infect the lung. It can cause, like, a lot of inflammatory cells can it can cause an inflammatory reaction in the lung. Okay, basically a lot of eosinophilia in the lung, pulmonary eosinophilia. That is called Loeffler's syndrome. Okay, for Ascaris, 3 words you need to remember. First of all, intussusception, intestinal obstruction, and Loeffler's syndrome. Okay, intussusception, intestinal obstruction, and Loeffler's syndrome for Ascaris. Now for Strongyloides, remember it. Like it is a very strong worm. Okay, so it does not need male for its development. Okay, it can undergo parthenogenic development. Okay, so the female itself can lay eggs without the help of the male. Okay, male is not needed for reproduction. That is parthenogenic development associated with Strongyloides. Now Strongyloides causes hyperinfection syndrome mainly in HIV patients. Now you can see the larva under the skin, and this larva moves fast. Okay, that's why it's called larva currens. Okay, that's why it's called larva currens. Now hookworm, you have 3 hookworms you need to remember: Necator americanus, Ancylostoma duodenale, and Ancylostoma brasiliens. Okay, Necator, Ancylostoma duodenale, Ancylostoma brasiliens. Ancylostoma brasiliens causes larva migrans. Okay, so this also you can see the larva under the skin, but it will move slower than the Strongyloides. Okay, Strongyloides is called larva currens, it moves fast. Ancylostoma brasiliens causes larva migrans. Okay, now how to look at both the worms. This is the Ancylostoma duodenale, and this is Necator americanus. Look at the buccal capsule of both. Okay, so these hookworms, they can cause iron deficiency anemia. What was the worm which caused B12 deficiency? That was Diphyllobothrium latum. Okay, iron deficiency anemia, Ancylostoma duodenale. Now to check whether the hookworm infection is a social problem, for that we use the Chandler's index. Very important. So if there are more than 300 eggs in the stool, in per gram of stool, then they say that hookworm infestation is a social problem. Okay, very important to identify the eggs of the hookworm. So remember, if you see an egg and inside the egg you see a cloud-like structure with segmentations. Okay, segmentations, very important for hookworms. Okay, so this is how you'll identify hookworm eggs. Okay, remember, hookworm eggs are very, very important. Lastly, let's go to the tissue nematodes. Okay, now tissue nematodes, you can either have the nematodes lymphatic, in the lymphatics, or in the subcutaneous tissue. Okay, so the lymphatic ones you already know: Wuchereria bancrofti and Brugia malai, which cause filariasis. Okay, also called elephantiasis, right? Elephantiasis. Now the infective form is the filariform larvae, which look like this. Now To identify these larvae, you should take the blood smear at night, okay, because at night only they will go into the bloodstream, okay. Now how do you differentiate between Wucheria bancrofti and Brugia malai? Now that is differentiated based upon the tail tip nuclei, okay. So look at the tail tip. On the tail tip here I see two nuclei, okay. If I see two nuclei at the tail tip, that is Brugia malai. Remember, don't confuse that with the sheath. This is the sheath of the larva, okay. The sheath is not the tail tip. This is the tail tip, okay. So at the tail tip you can see two nuclei. So this is Brugia malai, but here if you compare this, here this is the tail tip here. If you look closely, okay. So at the tail tip I don't see any nuclei, okay. So this is bancrofti. You can remember it like bancrofti is bankrupt, okay. It doesn't have any money, it doesn't have any nuclei at the tail tip, okay. Compare now Loa Loa versus Onchocerca volvulus. Not so important, okay, but still river blindness is caused by Onchocerca volvulus. Onchocercoma is caused by Onchocerca volvulus. Look at these images. River blindness transmitted by Onchocerca, transmitted by Simulian fly or black fly, okay. Simulian fly or black fly. Loa Loa causes calabar swelling and loasis. Here look at the worm in the conjunctiva, transmitted by Chrysops fly, okay. You can remember, you're crying Loa Loa, okay. You're saying Loa Loa and you're crying, and when you cry, you know, you have the swelling like this. So Loa Loa for calabar swelling, okay. So that is about the nematodes, okay. So this is about the parasites.